Hi guys, good morning. This is Rita. I'm here once again to bring another topic to us today. So today I'm gonna be talking about one of the infections of the vaginal and vulva region as well. So this video is dedicated to all my ladies out there, my girls, my women, wherever you are. Just try and listen. This video is very educative. It's going to be a blast. It's gonna help you guys, okay? So just listen attentively and try to get one or two from this video, okay? So let's dive into it right now. Like I said earlier on, my name is Rita, R-I-T-A, as in R-I-T-A, Rita, okay? So today's topic is gonna be, it's one of my favorite actually. I like all these infections of the vaginal region because I've read much about them. I treat a lot of that in the clinic. And I like to talk about things. I like to educate even my patients when I see them in the clinic. I like to tell them, you know, things that they need to know about all these infections. And today I said, why not bring it to your notice, you know, to everyone's notice out there, because it's gonna help. It's really gonna help you guys. So, today's topic is called fungal infection of the vaginal region. Actually, here in America, we call it yeast infection. It's another name for it is also called Candidiasis. In Nigeria, this is the most common name for it. We call it Candidiasis, okay? But in America, it's usually known as yeast infection. Both of them are the same thing, actually. It's just, you know, whichever country chooses to call it, whichever name they want to call it. But it's just basically the same thing, okay? So this candidiasis or the yeast infection is an infection caused by excess yeast in your system. We all have this, like I said before in my previous video, we have the good bacteria, we have the good yeast in our body. But when the bacteria are infected, they cause bacterial infection. And when the yeasts are growing rapidly, you can get this infection, making you to have this candida infection, okay? And the most common cause of like the yeast that causes this vaginal part of the yeast infection is called Candida albicans, okay? That is the yeast that grows rapidly and get infected and cause you to have this infection. So according to statistics, they said that this Candida yeast infection, it happens to over 1 million women in America, in girls, in ladies, in women. Like over 1 million people is like the population that it happens to every year in America. So can you imagine that? In America alone, more than 1 million people having this infection every year in terms of women. So not to talk about other countries, what do you think that will be happening over there? So that's why we need to know about it, okay? So, and what is the actual cause of this infection? This infection is caused by is an imbalance between your vaginal, how will I say it? It's like a loss of chemical balance. Okay, let's put it that way. That should be the right way to put it. Loss of chemical balance or imbalance in your chemical system within your vaginal and vulva region. Okay, so just listen and hear me out. Some people might say, how are we going to have loss of chemical balance? But let me just tell you how this can happen. So the loss of chemical balance, like I said, you have your good yeast, you have your good bacteria in the body, and those things are there just to make sure that your vaginal, your vulva area is being maintained, the balance is being maintained, to prevent you from having infection. Those things can also help you to prevent those infections climbing up your reproductive organs. But when those things are not there anymore, the good ones are not there anymore, what do you think will happen? Of course, the bad one will set in. So that's how the loss of chemical balance can happen. It's through an infection or something that can cause infection. When it enters there, it's gonna cause the imbalance, and thus infection will set in. So and this infection can happen due to taking like antibiotics. Okay, like last time I taught us about urinary tract infection, and I said you can take different antibiotics in order to treat the infection. So now those antibiotics that you take, in most patients that I've seen that have all this yeast infection, is usually caused by antibiotics. And so some of my patients will come in to take antibiotics treatment for bacterial infection or for any other type of infection, and they will remind you, they will tell you, oh, I usually get yeast infection when I take these antibiotics, so please can you also treat me or give me something that will prevent that yeast infection from coming up. Okay, so yes, of course, medication can cause that. It can cause that imbalance right there. Okay, another one is gonna be in pregnant women. Pregnancy can cause the hormonal imbalance in your system, and also sometimes if someone is pregnant, it makes them to pee more than needed. So when you have that constant urine going out there, it's also gonna throw out that imbalance in your system, and that will make you to have this Candida infection or the yeast infection. Okay, also in diabetic patients. So some people will say, what does diabetes has to do with Candida infection? Of course, it has a lot to do with it, because in your system, when you have diabetes as a diabetic patient, it's like excess sugar level in your blood, right? But now that makes you to pee a lot. And when you pee a lot, your urine is being tested. You have a lot of sugar in your urine. So this accumulation of sugar, you keep urinating, it keep dropping down your vaginal, your vulva area. Of course, it's gonna also cause that imbalance, and also grow, the yeast will grow from those sugar there, because the yeast, maybe they like something that is sugary. Of course, they're gonna take that advantage and also cause infection by growing rapidly in your system. Okay, so another one that can be a cause of this thing is like in patient that has HIV, AIDS, because of the poor immune system. Yeah, their immune system is not functioning properly because of their disease condition, the disease condition they have, and this makes them to have this infection as well. Okay, so those are the causes of this yeast infection of the vaginal region, the fungal infection, because it's a fungus. It's a fungus. Okay, the Candida albicans is a fungus. So those can be why, the reasons why those things, the Candida albicans or the yeast infection grows rapidly, and thereby causing you to have yeast infection. Okay, so what are the symptoms now? Let's jump into the symptoms of the fungal infection of the vaginal region. One of the symptoms I know very well is vaginal irritation. This vaginal irritation, like I said in my previous video, is so itchy, that very irritable, that when you start itching right here, you touch it, is so like, oh, the itchiness is too much, and some people tend to scratch their skin until blood starts coming out. Another thing that can be another evident signs and symptoms of this infection is some discharge from your vaginal or vulva region, and this discharge is like whitish, and it looks like cottage cheese. It looks like cheesy. I call it cheesy discharge from the vaginal region. This cheesy discharge, you know how the chunk of cheese is, and then when you try to scrape it with a knife or something, or just try to grind it, or just use something to dismantle the the blocked cheese, you will see how those texture of the substance will come out. Like that's exactly the kind of discharge you have in your vaginal region. It's usually white, it's non-smelly, it doesn't smell, but it's very irritable. It's very, very irritable, like very small. It's small, like, yeah, it's small, and then it's irritable as well. Okay, also another symptom can be redness and thickness of the what will I say, inner part of the vulva region. Okay, you have that swelling there. It can be swelling as well. You have the redness, or it can be thickness and redness, or the swelling and the redness as well. Okay, also you have the this thing, the inner part of the vulva can be like a cracked skin. It looks like cracks. When you touch it, it can be painful. When you pee, you can have, when urine touch it, you can have the burning sensation. So those are the symptoms of yeast infection, or the fungal infection of the vaginal region. Okay, so how do you diagnose this vaginal this yeast infection? How do you diagnose it? Seriously, it's through a pelvic examination. You know, it's kind of like doing pap smear, but right now you're not really gonna go to the service to take any sort of swab or something. You just have to put your speculum through the vaginal region, open it up, and check the kind of discharges the patient has. And also you can take the sample of those discharges and send it to the lab to know the type of fungus that is causing that infection, the type of yeast, because they have different types. Okay, so that when you're treating, it's supposed to be based according to what type of yeast infection that the patient has. Okay, so when you do that, you take sample and then you send it. But most times you can also look, when you put the speculum and open it up, you're just gonna see everything right there. Only the kind of discharge that the patient has and the symptoms, or these symptoms that the patient tells you, the signs or whatever that the patient tells you, that also will help you to conclude your diagnosis for this kind of infection. Okay, so treatment now, they have different forms of treatment. It can be oral treatment, it can be topical treatment as well. So in topical treatment, we have different types. Some people can also take the over-the-counter topical treatment, like the Monistat. The Monistat 7 is over-the-counter. It's a creamy-like medication. But most times, it's better for you to go in, talk to your doctor, know exactly which type of yeast infection you have before you take the treatment. Because sometimes it lasts, it lingers, and when it keeps coming back, it can cause other infections as well. Okay, so number one that we can use is something we call the Monistat. Like I said, we have the Monistat 3, we have the Monistat 7, and this Monistat, we also call it the Myconazole Cream. It's a antifungal cream that you can use. It's a topical medication that you can use and apply down there towards your vaginal and the vulva area, and it's going to help you to treat the infection. Okay, and also you can use the clotrimazole. The clotrimazole and the myconazole, it can be up to 2%. You can do like, yeah, so like I said, in the cream, the myconazole and the Monistat, okay, or the clotrimazole, you can have the 1%, the 2%, or some of them also come in 0.1, 0.2%. So it depends on what kind of yeast infection that the patient has. That will help you to like choose which one is better, which cream is better for the patient. Okay, there is something else that they call the Boric Acid. I haven't really used that, but there is also a cream they call the Boric Acid that you can use and apply on your vulva area or the vaginal area, and that's gonna help you to clear that infection right there. Okay, but the main medication, the oral medication that we use, is the Diflucan. Okay, so this Diflucan or the fluconazole is a tablet, and the dosage ranges from 50 milligram, 100 milligram, 150 to 200. So the basic one that we usually use is 150 milligram times 1 dose. If the yeast infection is severe in patients, you can go up to 200 milligram. I haven't really given 50 milligram to 100 milligram, no. So we usually give like either 150 milligram times 1 or 200 milligram tablet times 1. So when you give it to the patient, you can also combine it with the cream, and that will help to treat the patient. Okay, there is another medication we call the Pyruvating. The Pyruvating is like anti-itchy medication of the vulva area. Yes, it helps with the itchiness, with the irritation, and that one is like 100 milligram. You can give it 1 tablet up to 3 times a day for 3 days or 4 days. You can also go up to 5 days depending on how severe the irritation is. Okay, so the 2 tablets here, the main one is just the Diflucan or the fluconazole, 150 milligram to 200 milligram. That is the main one for the fungal infection. And then for the itchiness, you can give the Pyruvating. Yeah. Okay. So what are the things that you need to do to prevent you from having this fungal infection or the Candidiasis or the yeast infection of the vaginal region? Number one thing, like I said in my previous video, you don't have to douching or douching. Nigerians, we call it douching, or Americans call it douching. So do not do it, because those kills your good bacteria and also your good yeast in your system. So when you douche, it's gonna cause that chemical imbalance, and that will make you to have that infection. Okay, so another thing, there's something they call the female deodorants. I haven't really used that, but I know some people put a lot of things down there thinking that, oh, it's gonna help them to prevent the smell of the vaginal parts of the body. You know, the vaginal has its own smell, but when the smell becomes excessive, is another form of vaginal infection, and that can be our next topic next time. Okay, so some people use all these deodorants to make them not to smell down there, but they don't know that the deodorants are actually causing more harm than good to them. Okay, so another thing that we all have to do, to some people that don't do it, especially in diabetic or pregnant women, actually, because of the urine that you might be having down there. In terms of diabetic patient, they have this polydipsia, too much urination, and sometimes they have incontinence because of too much urine coming out. And then in pregnant women, they have this stress incontinence. They might cough and you see them dropping urine down there. So it's better to remove your underwears whenever you notice that it's wet. Okay, do not wait and say, oh, I'm doing this, let me finish what I'm doing before I can go remove the underwear. No, the more you wait, the more it's gonna cause more harm to your body than good. Okay, so another thing is this, a lot of people don't really know this, that during sex or when you're having sex, okay, in people that have husband, boyfriends, whatever you might have, so during sex you need to use only water-based lubricants. If you don't use water-based lubricants and use other types of lubricants, that can also cause the chemical imbalance in your body, and that will make you to have the infection. So prevention is gonna be no douching, use of water-based lubricants, remove your underwears like whenever it's wet. Okay, so I think this is gonna be the end of this topic today. If you have any question, you can write me or DM me in the inbox section, or you can also ask me questions through my YouTube page, and then I will be able to answer those questions. So next time it's gonna be another topic. For today is just a very short and quick one. So yeah, so that's gonna be the end of our topic today. Bye guys, take care, be blessed, and have a blessed day. Thanks. Bye bye.